So this is a simulated patient task assessing information gathering, communication with patient, communication with colleagues, patient safety and applied clinical knowledge. You are going to see Marie Henderson, a 15-year-old girl who has been exposed to sexual assault by strangers. She is waiting in A&E in a state of shock. Please take her relevant history and address her concerns.
You will find the patient is crying. Please don't give her water to drink. This is very, very important. Why? Because we will not allow the patient to drink or eat unless the forensic team come and take their evidence. So, by default, if you are seeing a patient crying, you will give her a water or give her tissue. Okay, for this patient, tissue is okay, but don't give her water to drink. Okay, be careful. So, first of all, when you tell her, hello, Mary, you will find she's crying. So you will wait little and then you tell her, I'm really sorry, Mary. I understand that you are severely distressed, um, but I'm here to support you and don't worry at all. We are here for only to help for your help only, and we will try to find who did this for you, and we'll try to do the best management for you, and we'll try to search for them and take your rights. She will stop, and then you tell her the first sentence you have to tell her that Mary, please be informed that everything will happen here will remain confidential, and we will not talk to anyone unless after your permission. So please feel free to talk to me so that you will help us to find any information about those strangers, and we will also this will also help us to put the best plan of management for you. Okay, and if you feel during the history that she is still upset, don't forget to tell her that we have a good counselor here. If you want to see the counselor, we can put you in put for you an appointment. Also, you have to consult the mental health assessment because this patient may got psychic trauma, and this may increase the risk of the patient to have to do suicidal attempts. Some like these patients after this event will suicide, so she needs full support. Okay, some patient will get also post-traumatic stress disorder, and later on she will suffer in her normal sexual life. Okay, so we have to put all these issues in our concern. So what are the risks that we are afraid of if the patient is exposed to rape? We have the risk of sexually transmitted infection. We have the risk of getting pregnant. Okay, so we have to give her or to screen her for sexually transmitted infection. At the same moment, we have to provide her with some vaccinations, some antibiotic prophylaxis, and follow up her, and we will deal with this patient as if all these strangers are infected. So we will give her the post-exposure prophylaxis and everything. Okay, I will tell in details later. The other risk is that she may get pregnant, and this is unwanted pregnancy. So if this patient is a candidate for emergency contraception, we have to provide her with that. Okay? Before getting to these two problems, first of all, we have to rule out the life-threatening injury, because sometimes the patient may have extensive tears from her vagina or down below, and she is bleeding profusely and she doesn't know. So first of all, we have to exclude the bleeding. We have to exclude also deep neck injuries, We have to exclude head injuries because sometimes they may hit her head, or while she is fighting against herself, they may do something. They may close her mouth forcibly or hit her by a heavy object or anything. Okay, so first of all, you have to rule out the life-threatening injuries. Okay, you have to see the extension of her neck injuries, the extension of any strangulation mark or any airway obstruction. Sometimes they may put something in her mouth to obstruct her way so that she will not shout. Okay, so search for any of that and examine her from down below to see whether she's bleeding profusely or not. Uh, First of all, we will refer the patient to the forensic medicine specialist after she is stabilized and counseled. But if the patient condition is unsuitable, either psychologically or medically, to be sent for a forensic medicine specialist, we can call them to come to the hospital and collect their samples. Okay? And we will inform the patient. Some patients will be afraid of doing that issue, but we will tell her we will not take the things further unless under your permission. But before we treat you, we have to collect the sample and we will keep them. We will not take them further. But if you changed your mind later on, okay, then we can do that. Okay? And you tell her that if she proceeds and if she takes the things further, this will help others and will protect others from having the same situation like you, and this will stop the strangers to do the same, and it will be like an example for other strangers who are thinking to do that, to be afraid to do. So it will be very helpful for yourself and for others also. So it's very important, and please be assured that no one will know you, no one will tell about you anything, and you will be totally and fully protected and supported. Okay, we have another thing here. This patient is under 16 years, so she's considered a child. So the issue here that we will inform the parents and social services, even against her wish. If she is above 16, she has the right to refuse. But below 16, no. She is considered as a child. Okay? So we'll tell her, Mary, because of your age, which is 15 years, according to our law, we have to inform your parents. She will cry and she will be afraid. We tell her, don't be afraid at all. You don't have any thing to be blamed for. This is not your mistake, and anyone can be exposed to the same thing as you. But it is by law to inform your parents, because we have to take the things further, because you are considered still as a child. So this is considered as a child abuse. So we'll inform the parents, we'll inform the social workers and social services. Okay. Examine the injuries and don't clean, don't dress them unless the forensic sample are taken. But if the injuries are actively bleeding, you can do the first aid things, but with with your precautions. Try not to touch anything. Try to be just making like stopping the bleeding or anything only. Okay, but if it is like simple and just oozing or something like that, don't clean, don't do dressing. Okay, this patient has multiple bite marks on her neck, so this patient is a candidate to have tetanus vaccination and antibiotic. Okay, so we'll give her the tetanus vaccine and antibiotic. We will give her the post-exposure prophylaxis for HIV. We will give her hepatitis B vaccine. We will give her antibiotic prophylaxis for chlamydia and gonorrhea. We will refer her to the local sexual assault referral center. What is the local sexual health assault referral center? Um, each town or each area in UK has uh, a local referral center which is specialized to deal with these cases. So we will refer her to the local center according to her residency. Okay, it's called local sexual assault referral center. Then we will provide her with emergency contraception. We will ask her about her last menstrual period, whether it is regular or no, and whether she is sexually active from before or this is the first time for her. Because if she is sexually active, maybe she is on regular contraception, so no need to give this emergency contraception. Okay. What if she is if she is taking already contraception? We will ask her about what is the method. If it is tablet, what about the compliance to this tablet? Any missed pill in this cycle? And you ask her about what happened exactly. She can explain you the scene and ask her, do you know them? And how many people were these strangers, and this happened where exactly, and what kind of violence they did for you. Okay, is it they penetrate from down below or only other areas? Okay, and whether they were using condom or no, and whether you change your clothes, whether they give you something to drink or you were aware of everything. Okay, and whether you got any consensual sexual intercourse in the last few days or no. Okay, and ask her about the rest of history to explore if she is taking any enzyme inducer, if she is having asthma, if she has any problem, because you are going to give her emergency contraception, so it will apply as the same history as emergency contraception. Okay, from the examination, we will assess also the BMI, okay, and we will take swab from the vagina, okay, and we will examine her for the infection. We will tell her to come after 10 to 14 days for again assessment, because sometimes even we will assume that those strangers, because they are doing the same issue frequently, so we will assume they are infected. So even we give her the antibiotic prophylaxis, even we give her the HIV post-exposure prophylaxis and hepatitis B virus, maybe it is not effective, and maybe she also catches the infection. So she has to come after 2 weeks. So we will give a chance for her body to show the infection that she got, and we will assess her again. We'll take samples and do our investigations. Okay. The most important here is to reassure her all the time, and we will be supportive. We'll explain to her what we are going to give and what will happen later on. The most important is to confirm confidentiality, unless she's under 16, we will tell her parents and social services. Okay, and regarding the forensic consideration, should be upon her consent. Okay, as I told you, if she refused, we will tell her that we will not take the things further unless you tell that, but we have to collect the evidence, whether you want or no. But because this patient is under 15, so the consent here sometimes will not be applied for that, because this is considered as a child. So we have to do it. Okay, we will take some kits from the mouth or a urine sample to check if there is any drug intake, like we'll do like toxicology to exclude drugs intake or anything. Even the clothes that she wear, we will remove them and put it in a bag to be analyzed. They will search for any parts like hair from these strangers, or even drops of semen, or any other marks like nail inside the skin, or anything that make us to reach for their identity. Okay, so I know this is a difficult station, but it came before actually, but it came actually a long time back, but who knows what may happen later. Okay, okay, thank you.